Welcome to my scientifically informed insider look at mental health topics. If you find this video to be interesting or helpful, please like it and subscribe to my channel. Hello, this is Dr. Grande. Today's question is, what is the sociopathic stare? Sometimes this is referred to as the psychopathic stare, which may actually be a better name for that. I'll get to that in a minute. So this particular construct, the sociopathic stare, is sometimes observed with psychopathy and sociopathy. The evidence that supports it's really more anecdotal, and there are not really a lot of research studies out there that have studied this construct. Robert Hare, who created the psychopathic checklist, which is a fairly popular instrument for assessing psychopathy, indicated that he would observe a fixated stare, a prelude to self-gratification or an exercise of power in individuals that he was assessing who had psychopathy. He also indicated that it was not a stare of interest or of empathy. Now, we've heard the stare referred to by a lot of descriptors. For example, cold, detached, emotionless, lifeless, dead, blank, empty, icy, intense, piercing, and penetrating. So a lot of different adjectives to describe this particular phenomenon. So to understand the sociopathic stare or the psychopathic stare, we need to understand a little bit about psychopathy versus sociopathy and how that relates to antisocial personality disorder. So psychopathy is a construct, it's an area of study, and we see with psychopathy there are two factors, factor 1 and factor 2. With factor 1 we see traits like superficial charm, grandiosity, being callous or unemotional. This construct of fearless dominance is also referred to as boldness, being manipulative, having a lack of empathy, remorse, guilt, having shallow affect or a shallow display of emotions, and pathological lying. Again, all those characteristics are related to factor 1 psychopathy. This factor is sometimes referred to as interpersonal affective. Now for factor 2, this is referred to as social deviance. We see a different set of characteristics. We see excitement seeking, a parasitic lifestyle, impulsivity, irresponsibility, poor behavioral controls, and criminal versatility. So really, factor 2 psychopathy is much closer to the diagnosis in the DSM of antisocial personality disorder than factor 1 psychopathy. And a lot of times when we talk about sociopathy, we're really talking about factor 2 psychopathy, which is why earlier I indicated that the sociopathic stare is really probably better referred to as the psychopathic stare, because a lot of the characteristics with factor 1 psychopathy appear to line up with this particular type of staring, like being callous, unemotional, having fearless dominance, and having shallow affect. Other constructs don't seem to align too well with this particular type of staring, like pathological lying, being manipulative, and superficial charm. You would think that these characteristics would be kind of incongruent with the stare, because the stare would have an effect on individuals where it would make them nervous or fearful. And really, if you're trying to lie, that might not be the best strategy, and superficial charm seems to be fairly inconsistent as well. In terms of being manipulative, I guess you could make an argument that it's both congruent and incongruent in some ways with this stare, and I'll talk about that in a moment as well. So really, when we talk about psychopathy and sociopathy and antisocial personality disorder, and we talk about the stare, again, we're mostly talking about factor 1 psychopathy. So this construct of the psychopathic stare is interesting, but is it real? Well, as I mentioned before, it is supported by some anecdotal evidence. There aren't really a lot of research studies that directly support it. It may be a characteristic of psychopathy and sociopathy, but if it is, it's certainly non-specific. So let's talk about some of the research that maybe supports and to some degree refutes this construct. So with the construct of psychopathy, in particular that callous, unemotional characteristic, we see this is actually associated with impaired eye contact. So this information leads us to believe that the psychopathic stare maybe isn't real. Now we also see decreased reactivity to facial expressions with psychopathy. In particular, a deficit in the ability to recognize fear and distress. So here we believe an individual becomes more focused on their goal because they're not distracted by fear and distress. This would tend to support the idea of the psychopathic stare. We see in 2016 there was an article published by Joyner and colleagues where they theorized that an unblinking stare, so a low blink rate, may be associated with violence and suicide. But really this study was there to draw more attention to this construct and didn't deliver a lot of direct evidence in support of it. Now we also see in a study published in 2017 by Wick and colleagues that staring can be interpreted in a lot of different ways, and we have to consider the nature of staring and how it's interpreted. So a sustained direct eye gaze, staring, can be interpreted by some as threatening, and this can lead to fear. But by others, it can be interpreted as a sign of attraction, interest, or even love. This is really dependent on who's perceiving the stare. If someone's inclined to anxiety or distress, they're going to interpret that stare as, again, threatening and tend to avoid the person doing the staring. There's a submissive component here. Now, if somebody's confident, secure, and dominant, they're going to be comfortable and maybe even approach the individual who's staring and confront or challenge them. So sometimes if you have two individuals who are both dominant and who are both staring, this could result in a verbal argument and maybe even some cases a physical argument. So we see some research that gives us maybe a little bit of insight into this construct, but as I mentioned before, this characteristic is non-specific. So what that means is you really can't use it validly to make an assessment. It can be information that's helpful, but it doesn't really point clearly to a diagnosis, for example. So we have this construct of the psychopathic stare, and as I mentioned, of course, a sociopathic stare, but also there's a narcissistic stare, and this construct tends to be linked to psychopathy. There's an overlap between these two constructs. We see a stare associated with borderline personality disorder that we think is more based on anger. We see a stare with paranoid personality disorder, which is really more of an evaluative stare. Somebody's trying to determine if they can trust another individual. We see a stare associated with OCD, obsessive compulsive disorder, which of course we think is a compulsion. And we see a stare associated with schizophrenia. This is usually described as staring into space, and eye tracking doesn't occur here. So somebody's not going to move their eyes and track you as you move around the room. Usually with schizophrenia, usually they'll just keep staring past you. With psychopathy, we usually think of the eye tracking as being in place. They're going to follow you as you move. Now we also see with schizophrenia that this may be caused by the negative symptoms like flat affect. It could be caused by distraction, perhaps from hallucinations. And with schizophrenia, we also see a low blink rate. And of course, if somebody doesn't blink very often, that appears to be staring behavior. So what causes the sociopathic or psychopathic stare? Well, here it's really just speculation. But if I had to guess, I would say it's related mostly to that fearless dominance component. Also, it could be a social cognitive deficit, not really understanding how to relate socially, how to navigate relationships. And also, as I mentioned before, it could be related to manipulation. Staring makes people uncomfortable, and this could facilitate manipulation in some situations. But either way, no matter what causes it, we need to use caution when considering the psychopathic stare in appraisal. There are a number of different possible reasons somebody could be staring, and again, this particular characteristic is nonspecific. I hope you found this description of the sociopathic stare or psychopathic stare to be interesting. Thanks for watching.